74-year-old man has new agitation for the past 2 days. For the past week, he has had norovirus and has been vomiting since. He has been unable to keep anything down. He has Parkinson's disease and takes oral coca-levodopa daily. His temperature is 39.7 degrees C. His pulse is 115 beats per minute, and his blood pressure is 156/93. All 4 of his limbs are rigid with hyperreflexia. Which option would be used to prevent the most likely diagnosis? A. Intravenous procyclidine. B. Haloperidol. C. Oral coca-levodopa. D. Oral tetrabenazine. Or E. Transdermal dopamine agonist patch. I'll give you some time to consider the right answer. The correct answer is E, transdermal dopamine agonist patch. This question is discussing Parkinson's disease, and in Parkinson's disease, it's crucial to take dopaminergic medication on time to prevent neuroleptic malignant syndrome, also known as NMS. This occurs due to a sudden decrease in dopaminergic activity. Missed doses of medication can precipitate NMS, characterized by fever, altered consciousness, agitation, tremors, muscle rigidity, tachycardia, and hypertension, as seen in this patient. Given the patient is unable to tolerate oral medication, a transdermal dopamine receptor agonist is the best method to administer the medication and prevent NMS. Parkinson's disease. Parkinson's disease is a condition where there is a progressive reduction in dopamine in the basal ganglia. This leads to disorders of movement. These symptoms are characteristically asymmetrical, with one side of the body being affected more. The typical patient is an older man, around 70 years old, with a gradual onset of symptoms. There is a classic triad of features in Parkinson's disease: arresting tremor, rigidity, and bradykinesia, meaning slowness of movement. Bradykinesia can present in a number of ways, including smaller handwriting and small steps when walking, also known as a shuffling gait. Other features can include depression, sleep disturbance, a loss of a sense of smell, postural instability, cognitive impairment, and memory problems. Diagnosis of Parkinson's disease. Parkinson's disease is diagnosed clinically based on the history and examination findings. The diagnosis should be made by an experienced specialist. Treatment is initiated and guided by a specialist, tailored to each individual and their response to different medications. There is no cure. Treatment is focused on controlling symptoms and minimizing side effects. Treatment options include medications. One example is levodopa. This is a synthetic dopamine taken orally. Levodopa is the most effective treatment for symptoms, but becomes less effective over time. Other medications that can be used include dopamine agonists and monoamine oxidase B inhibitors. Other treatments in the NICE guidance include deep brain stimulation, physiotherapy, speech therapy, and occupational therapy. Complications of Parkinson's disease. Complications can include autonomic dysfunction. Some examples are postural hypertension, constipation, urinary frequency and urgency, recurrent falls, and cognitive impairment. Some examples include Parkinson's disease dementia and Lewy body dementia.